Hey everybody, I just want to welcome y'all to the forum tonight on campaigning patient advocacy. My name is Crystal. I am a LPN and um, BC for Georgia Dermatology in Georgia, of course. Um, so welcome everyone. So we are just touch on the BCoD conference is going to be November 2nd through the 4th, and it'll be in Atlanta. Um, Last year was my first year that I went, and it was really great information that I was able to take back to my offices, and I've learned a lot on it. The registration is $49. That includes like all your breakfast, your lunch, reception, education sessions. Um, and if you book your room at the time of or when you register, you'll get a $50 credit. So basically, you're getting the conference for free. Um, and there's also in the um, website, there's support tools for like a employer support memo, and then discount multi attendee discounts for practices. So you can always check that out. So uh, we will go ahead and get started. So we're talking about getting your patients involved in um, basically like getting involved in their approvals for their biologics. Some ways that you can have them get involved is you can have them write an impact letter or a statement stating that you can attach to their appeal letter. So it'll basically be in their own words how their condition is affects their daily life, and if it limits their ability to work, they're not able to walk very well, just because of the um if they had psoriasis, say, on their feet or legs or whatever. um so they can if it's affecting the itching and everything, if it's affecting their sleep, and just performing their everyday activities. So we just wanted to, let's see, sorry about that. I was reading one of the chats. Let's see. So another thing, anyway, so they can like do a statement. It can be a short paragraph, just anything basically in their own words, stating why they really need the medication. Um, and then they can get that to you. You can attach it to the appeal letter, and hopefully will help a great deal. They can also go to their HR department and talk with their HR team about the lack of coverage on biologics with their insurance companies. Um, Usually that would probably be best if done closer to open enrollment. Um, and at that time, the patient can explain that biologics are a standard of care for many chronic conditions, and that current coverage creates barriers for their treatment, delay in their care, and could increase long-term cost as far as with the insurance, if not covering the biologics. So better coverage would help employees stay healthier, more productive, and reduce disability and absenteeism. And I would also let the patient know to emphasize to the employer that wellness and productivity, for the employees is vital and not just a personal need, that they're, really thinking about their other employees also, or their coworkers. And then also suggest that they, do like a HR survey with the employees about their healthcare needs, because biologics are often, as we all know, a lot of people use them. So, um, and then also I would have, if the patients were, saying that it's taking too long to get their medicine or whatever, and you've already got it approved and everything, have to call the specialty pharmacy. let them know that it usually does take 7 to 10 days because they're processing. Even though we know they've gotten approved, the pharmacy is also doing they're doing their verification of benefits and all that, and making sure that everything's right. So I would just tell the patient, they can call them every day if they wanted to. It may speed up the process, it may not, um, and let them know that they could be on hold for um, several minutes whenever they do call. And I would, as a tip, would tell them to, write down whenever they do talk to someone, write down the date, the time, the name of the person they spoke with. So that way they can get the answers that they need. Or if they have to call back, they can say, well, on this day I spoke to so and so, and this is what they told me. So, does anyone else have any suggestions or input on how they get their patients involved with getting their medications approved? Sorry, didn't mean to do that. I hit the wrong button.
Hello. There we go. All right.
Sorry, I saw everyone's muted, so we will unmute everyone. I'm working
Yeah, I
on
Oh,
it.
think
okay. I
I
was like,
think we're
okay,
unmuted
nobody's
now.
Yay!
talking.
I was like, I can't say anything. All right, go ahead. Everyone speak.
Well, hi. Can you hear me?
Yes.
Yes.
Well, I'm Naisha. I'm a biologic coordinator, and I work for the skincare center. And some of the ways that I get my patients involved is to, like you specified earlier, by them writing a letter. I also sometimes have patients keep journals, take pictures, have them get letters from family members. Um, I give out, I always give the patients the information to the pharmacy. And I always tell patients, too, that they can always check with their insurance, if they're uncertain about like coverage, benefits, and, because I feel like it's always good to check. I always like to have patients advocate for themselves because I think it
Hmm.
makes them more aware of what's going on. And you should, though, what you're
Yeah.
getting yourself into. So, I give out handouts outlining, hey, this is what you should expect in the next several weeks. You meet with your doctor, they come up with a treatment plan, then, it goes to prior authorization, insurance. If it's approved, whether or denied, then it goes to this specific way if it's denied, or this specific way if it's approved. And I kind of like outline it for the patient so that way too, they know what they're getting themselves into. And then that way they can decide on to, if they want to be more in hands-on or not. Because you do get a lot of patients that are more hands-on, and then you get some patients that are like, I'll leave it up to you. But I really do encourage them to like get involved because I really think it is important. It's very important. So I think
Yes.
what you said earlier was right on.
Well, thank
Hi, this is Sarah with Center for Skin Wellness. I just wanted to share in our demographic, we have a lot of self-insured funded plans. And going back to the earlier point of getting with HR, oftentimes they can overturn a decision from the HR department if it's a self-funded plan,
you. Oh,
um,
okay.
rather than going through one of our county insurance plans is through Aetna. and the county can decide what they want to cover versus having to adhere to the third party contract
Okay.
as a thought.
Yeah, that is definitely a good thought. Amy,
Yes.
I thought I saw a hand raise. That may have been Sarah's.
Oh, it was, yeah, I think it was
Sorry.
from before. Yeah, no worries.
Okay.
I wanted to ask Naisha, that handout that she gives, is that something that she came up with?
Yes. So I made it up myself. And too, in my handout, it actually has, information about copay cards, because I think too, a lot of times, I have to tell patients, when the pharmacy calls you, ask questions, because again, they don't always, let us know, if the patient has a copay or not. So I always tell patients, even though I add the copay card, a lot of the times when I call in their prescription, but I also encourage patients to do that as well, and to definitely check to see, what your copay is, and I would tell them, do not let a pharmacy send out a prescription without you asking questions. That you should always
Yes.
ask questions no matter what.
Yes, I agree with that, because I know there are a couple of the pharmacies that will go ahead and send the medicine, and then, a few months later you'll get a bill for, $3,000.
You are definitely right about that. Is it our famous pharmacy, Accredo? Oh, did I say that?
Don't.
We said
Well,
the quiet part out loud.
Holding by the defense, 3-yard penalty.
So
I'll say
funny.
it starts
But
with an A and ends with an O.
I know, but I always warn patients because of their billing practices, because it's so backwards, where they technically send the prescription and then bill the copay card later. So if there are issues with they're chasing down patients, and I'm like, well,
Mm-hmm.
like, you didn't have authorization to ship that. Like, the patient was under the impression it was this copay, and then later on you told them it was different, but you've already sent them the medication. Like, that's on you. That's
Mm-hmm.
your issue.
Yep. And that would also kind of go back to, if you talk to somebody, get a date, a time, a name, everything. So that way, they can say, well, this person told me that this was how much I had to pay, and that was it.
Yeah, reference numbers are your best friend.
Yeah.
Very much so.
Very true. I love getting patients involved though. Definitely, like, that quality of life statement, having them, write their own statement to their insurance company and advocate for themselves on behalf of their
Mm-hmm.
medication, and then speaking to their HR company if they need to. I think that's such a big thing that we don't always like talk about or go that
Yeah.
extra mile with, because I think it really can make a big difference, because I don't think a lot of people realize, you do have a voice with your HR, and you do
Mm-hmm.
have a voice with your plan. And if enough people speak up, sometimes it's just as simple as the employer doesn't realize that that plan was doing that because they didn't have somebody in that situation. And then as
Yeah.
soon as the employee says, hey, do you realize what's happening with this plan that we chose? A lot of times that company can turn around and say, oh, no, we didn't. Let's see if we can fix that.
Mm-hmm. Because I do know, biologics are expensive, yes, but in the long run, if they go ahead and approve them, get the coverage for them, it, like I said, long-term cost, it can help with it.
Mm-hmm.
So,
This is Sarah again. In our demographic, we see a lot of pediatric atopic dermatitis, and I'm sure
mm-hmm.
everyone else does as well. And something I've seen plans trying to do is trying to impose oral immunosuppressants or drugs that may not be indicated yet for that age group, and letting
Mm-hmm.
them know that it's off label for them to consider it. is very important, and also how it impacts the family. One of our physician assistants is very passionate that by not having children's atopic dermatitis or any inflammatory disease controlled, it impacts their growth and their development,
Mm-hmm.
because it impacts their
Mm.
quality of sleep. So kids are going to
Yep.
underperform in education and growing benchmarks if they're not adequately controlled with their autoimmune condition.
Mm-hmm.
That's such a great point.
Yeah, I had a couple of years ago had a pediatric patient that of course they were Medicaid. They I wanted them to do one of the, either methotrexate or cyclosporin, one of the um medicines that you would not want a 7-year-old on. So basically, in the appeal letter, I told them, I was like, look, this will decrease, these medications will decrease their immune system, which in turn, they're in school, so they'll get sick more often. They're going to miss more school. They're going to get behind in school. So finally,
Mhm.
I was able to get it approved.
Good for you. That's a good one. Yeah, I feel like offices are always asking me how to get around the systemic requirements from so many insurance companies in order to get a biologic. And so I mean, I feel like there are some that we all kind of know, but I'm curious what you guys all use.
Well, if they say methotrexate, I basically just tell them that, medication um, interactions, because there are several of the over-the-counter medicines that will interact with methotrexate.
Mm.
If they're of childbearing age, you know, that is counting against them. And there's a possibility for males that it could, you know, make them sterile.
Mm.
So,
And I think too, even drinking alcohol, like if like with methotrexate, they can't drink alcohol. I think I even Googled one time and did some research where if they donate blood, it's not good.
oh,
Mm.
Don't quote me on that one. I mean, I've Googled it,
yeah,
and I threw it in the appeal with some other stuff, and it was fine, and it got approved. But hey, you just I feel
yeah,
like I feel like with the appeals, it's all about who's reading them.
exactly.
So yeah.
I started putting on mine. And Emma has the plan as far as initiation that the patient won't be able to complete the labs required for oral immunosuppressants, or
Hmm.
that the provider can't attest that the patient will be compliant with alcohol avoidance, as it could lead to hepatotoxicity as a big point.
Hmm.
Yeah, that would be a good one.
One that I learned last year that I found really helpful at the conference was someone had shared with Elidel that it's against the PHI to have sun exposure. And that was something that I found really helpful.
Oh,
Hmm.
Wow.
And
That's
so
a
do
good
that.
referral.
what I did, which I really, really like to stick it to the insurance companies, is I'll put the hyperlink for the PHI for Elidel and then send it with it in circle,
Uh-huh.
that it's
Mhm.
contraindicated.
That's my favorite. I love using labels against insurance companies. I
Mm-hmm.
think that's one of my favorite tools. Like
Mm-hmm.
when they try to say to like use Eucrisa And I'm like, well, that's indicated for mild to moderate, and this patient is moderate to severe, so it's not indicated for them.
Mm-hmm.
Or
Right.
like Tesla, mild to moderate when patients are moderate to severe. And it's just like
Mm-hmm.
those little terminologies, those little verbiage things that are in the labels that insurance companies just gloss right over. But when you
Yeah.
stick it to them, they usually have to abide by it.
Mm-hmm.
Yeah. I think it's just somebody sitting behind a desk is just clicking, clicking away. Are these
Hmm.
answered the way they need to be?
Exactly. And until you call them out on it and say like,
Mm-hmm.
no, this is how it's written, this is how it's labeled, like you have to abide by it. They'll do whatever they want, really.
Mm-hmm. Oh yeah.
I have an anecdotal one that I can share with you guys that was interesting.
Mm-hmm.
So I
Hmm.
had a patient that has Crohn's, psoriatic arthritis, plaque psoriasis, and atopic.
Oh wow.
Mm-hmm. We have him on Rinvoq. He's doing well and he's on Bridge. The insurance company took the chart notes, and I don't know whether it was a person or AI, but saw that his plaque psoriasis was doing better and were writing for the indication of atopic, denied it and said that he needed to use topicals. When the chart notes said that the atopic dermatitis was inadequately controlled. Keep in
Hmm.
mind, he had already failed Dupixent and Sabinco. And so I sent it back for an external case review because they didn't read the chart notes correctly. And it was
Right.
Mm-hmm.
actually the provider that wanted me to send it because he also had the ulcerative colitis indication.
Right.
Hmm.
And her
Interesting.
argument was, well, technically with UC, they would have to be on a higher dose, but she still wanted to argue it.
Of course. Wow. Yeah, I've come across insurance companies doing similar things where they're like misreading diagnoses or things
Hmm.
like that. And I don't know if it's AI or if it's just mistraining or whatever it is, but I had one where the patient was on Dupixent for AD, but then they also got poison ivy. So they came in for contact dermatitis for their poison ivy and got like a steroid for it.
Mm-hmm.
And then the insurance company came back and was like, no, they can't have Dupixent anymore because they're flaring. They're not doing well on it. And I was like, no, no, no. Their notes are so clear that their AD is under control. It's clear. They're 0% BSA. It's written right there. I was like, the flare is poison ivy. I'm like, those are two separate diagnoses, but insurance
Mm-hmm.
companies, people reading them, they're not clinically trained. They don't understand
Yeah.
that until tell that to them, and it's so frustrating.
Mm-hmm.
I do have a question for the team that's kind of off topic.
Mm-hmm.
Um, in our demographic in Florida, I'm having struggles with plans not sending decision letters for appeals. Are you guys having issues with that in your demographic?
Yes.
Okay.
Which I'm right.
Yeah.
I'm in Georgia, so I'm right there above you. So,
Gotcha, gotcha.
um, but yes, I have had several times that I've had to call, because I never got a response or anything, get a letter or anything, about the appeal. So I've had to call and follow up on them.
Yeah, I had an instance within the last couple weeks. Uh, Blue Cross of Florida was telling me that I needed to get with the patient for the outcome letter. And I didn't know if anybody,
Really?
yeah. And I was wondering if anybody else had experienced that.
Yeah, I've seen a lot of insurance companies do member driven appeals. And so a lot of them will do, I'm sure you've seen kind of like that where obviously like the patient they require a signature from the patient in order for them to even
Mm-hmm.
work the appeal from us.
Mm-hmm.
But then the same thing is now happening on the back end where not only are they requiring a signature from the patient to authorize the appeal because it's a member kind of driven appeal, but then the response they're sending directly to the patient and they're not even including us in the practice.
Wow.
Righty.
Yeah, to make our jobs a little bit more
Yeah, really.
complicated.
Yeah. I've even had them playing against each other where they're like, "Oh, call the PBM." I'm like, "No, no, no, no. That's not how this works."
That's my favorite argument. When you have to tell them that they are required to do their own appeals. You tell them that they handle their own appeals and they're like, "No, we don't." And I'm like, "Yes, yes, you do."
My favorite is when they're like, "Have you tried Availity?" I'm like, "It's not there. If it were, I wouldn't be calling you."
Right. Do you think I wanted to pick up the phone and call you today?
Like, no,
Exactly.
no.
Oh, that's my favorite question. Did you try the portal? Did you try the website? Yes, I tried that first and now I'm here.
Yes,
Mm-hmm.
yes, I did. I even went, I was so mad one day and frustrated. I'm like, you know what? They're going to humor me today. I called Availity. I'm like, tell me where it is. She didn't know what I was talking about. I'm like,
Right.
never
Walk
mind.
me through it.
I'm like, I'm wasting my time. She didn't even know what an appeal was.
Mm,
I'm like,
Oh no.
this is bad.
so
I'm
frustrating.
like, I'm not going to waste my time here. Good day.
Yep.
Yeah.
Have a great day. Thank you so much. I did that the other day. I was on a call with somebody, and the person, honestly, it was an iPledge thing because I do iPledge for my
Mm-hmm.
practice. And
Mm-hmm.
she basically, everything that she told me was the complete opposite of what I was finding out in reality because I was following her steps to the opposite behind her back.
Oh,
So like she told me like, oh, well, you're not going to be able to see it from your end. You're only going to be able to see it from the provider side. I was logged in on my end and I could see it on my end, but I had been logged in on the provider side and I couldn't see it on the provider side. And then so I was like, okay, fine. So then I did it on my end. And then she was like, and now from here, you're only going to be able to do it from your end. You're not going to be able to do it from the provider side. And it was the complete opposite. I was like, okay, thank you so much. Have a great day.
sorry.
And then I just giggled.
That's awesome.
I had an insurance company that took the paper that the patient had to sign for us to do an appeal as the appeal, didn't allow us to send any extra documentation and denied
Mm.
it based on the patient signing that paper, but then wouldn't send me the actual appeal denial letter. It said that they wanted us to change it to a biosimilar of a different medication, not even the same medication. And I
Wow.
had to call and spend 2 hours on the phone demanding them to send me the actual appeal letter. And I had to specify I needed to say denied on it before they would send it
Mm-hmm.
to me.
Mm.
Wow.
That's
So
crazy.
frustrating.
Yeah, I've
Yep, that was
also
the only thing my FRM needed is just that denial on the letter.
Right. And it's so funny trying to explain that to the insurance company. I'm like, I don't care that it's denied. Just send me the denial.
right.
Yes.
Yeah.
Yeah, I've had a lot of high co-insurances here, and I've argued with Blue Cross ones. I'm like, just deny it. You're not paying anything. You're just trying to keep your numbers up.
Mm-hmm.
Good point.
Their response was, tell them to pick another plan.
Oh,
That that was a 1980s hang up.
hmm for
Yeah.
sure. That's yeah, you wish you had a
Uh-huh.
landline for that one.
That
Yes.
really
Uh-huh.
did.
What a response though. Like that's so infuriating. Like just
Mm-hmm.
that's not it. That's a non-response. That's a non it's not fixing anything. It's not changing
No,
anything. Like choose a
Mm-hmm.
different plan. Like no, no. Like this plan shouldn't operate like that. It shouldn't
no,
exist.
and it's completely apathetic on their part.
Right.
They're there to service the patient, and it's
Mm-hmm.
just so frustrating.
Yes. And I had one plan that it said that it was Optum was their their pharmacy insurance and everything. Called them and they kept telling me, no, we're not. So then it had to go through a third party or whoever. And then I finally got somebody on the phone. They said, yeah, we don't cover any insulin at all.
What? What about
Yeah.
EpiPens?
Insulin is the only injectable medicine they will approve.
Wow.
I dealt with that also, that same
And
thing.
it was an insurance company with a pretty big restaurant business. And it was
Oh,
Cracker Barrel.
Wow.
well, they'll need the insulin. Sorry. I go to Cracker Barrel quite a bit. I can say that.
Yeah.
I love that. So funny. Yeah, more and more plans have no biologic coverage, no specialty medication coverage, and they completely carve it out.
Wow.
Mm-hmm.
Yeah, or they have to call the insurance to apply for the specialty medications to be covered.
Yeah.
I'm seeing more of that lately.
Wow.
Yeah. Yeah, and then like there's these plans that have a third party that the patient has to like apply for patient assistance with, and then
Mm-hmm.
they get denied for patient assistance, then they can go back to the plan and say, okay, I couldn't get it through patient assistance. Will you cover me now? And then the insurance plan will cover them.
Right.
Mm.
Well, and the other crux too is some manufacturers, with their PAP programs, when they're screening, if their income is above the threshold, they still can't essentially afford the medication either, and,
Right.
and that becomes
Mm-hmm.
a contentious conversation.
Yeah, I've had to do quite a few of the MPPP programs.
Mhm. Yeah, in my area, I've had good success with the Medicare prescription payment plans.
Mhm.
So, I don't know if that's like going to be true continuing, but like the enrollment has been easy for patients.
Yeah. Oh,
Yep.
yeah. I've even had them do it from within the office just because
Yeah,
they're like, what do I do again? I'm like, just sit down, call.
just call them.
I made a step by step for patients.
Mm-hmm.
Super
I
smart. I
may need
love
to
that.
get with one of y'all on that then.
I was going to say, can we share that after the conference?
Yeah.
Oh, please.
Next forum will be
Yeah.
Medicare.
Yeah,
Now,
no, seriously. Well, I mean, yeah, that's a couple of things. So we used to have a resource in the past. We had like a specialty medication start guide. So we can see if
Mhm.
we can do that. And then of course we can see if we can do like maybe like a Medicare prescription payment plan script or
Mm-hmm.
something and get that up on the website for us.
that'd be awesome.
Yeah.
Yeah. I use the step or the initial start one, and then I've added to do the MPP program on it, as well as the Medicare. Oh wait, no, the Social Security one.
Oh, right. That like the extra help program.
Yes. Yeah.
Perfect. Yeah, awesome.
Does anybody have any, now looking into our crystal balls, do we know anything for 2026 as far as Medicare for next year? Or is it too early?
I haven't heard anything.
So I've heard that it's going to be 2,100 for an out-of-pocket maximum next year,
Okay.
but that's the only update that I've heard.
Yeah, I haven't heard anything yet.
I was gonna say I usually don't hear anything until about October.
Mm-hmm.
Yep.
Yeah, I was curious on also too if patients are going to have to re-register for the new year for a little carryover.
Oh, right. Yeah, I'm curious to see. Hopefully they'll start getting paperwork, I would say in the next month or so. So maybe we'll hear from patients.
Yeah.
Mhm.
I'm betting they're probably gonna have to reapply.
I think so. I don't think it will be automatic, but I don't know. You never know. It's Medicare.
Yeah.
True.
Yeah, I'm thinking some plans will probably be, easier than others. Like maybe some will have an automatic enrollment option, others I don't know. Yeah, I think it'll be dependent on plan.
Mm-hmm.
Mm-hmm.
It will be interesting to see. But yeah, that's something we can definitely, I'm sure, be talking about at the conference because it'll be, November. So
Mm-hmm.
Mm-hmm.
Yeah.
we'll have some updates and we'll see. So that'll be exciting.
Mm-hmm.
Well, I know it's getting late. Well, for some of us, I don't know what other time zones y'all are in. So, but I know some people are probably getting kids ready for bed and everything. So, but thank y'all so much for your input um and everything. So I think we got some really good suggestions and everything. So really want to thank y'all for that. And also be on the lookout for the next I know there is a oh, there it is. Um Amy's doing a webinar. Is that next Tuesday?
Yes, the 16th.
Okay. All right. And then we'll have another forum on October 14th. Another check-in series. So look forward to seeing or talking to everybody again on that. So uh anybody else have any more updates or anything they want to add before we end for the night?
Nothing on my end. Thank you so much, Crystal. This was awesome. Thank you all
Yeah.
for joining. I had a great,
Yeah.
great night. It's always good. I feel like this is almost like unwinding together.
Love it.
Yeah. Yeah. We can all unwind and fuss and complain about, pharmacies and insurance companies.
Exactly.
Oh,
Get it off our chest and feel better for the next day.
That's
exactly.
right. Yes.
Empowered.
This was definitely worth it.
Yeah.
Definitely.
So, well, thank y'all so much. I hope y'all all have a good night, and I hope to
You too.
see everyone at the conference.
Absolutely.
Yeah.
All right.
Good
All
night,
right. Well,
everyone.
y'all
Good night.
have a good night.
Night.
Bye.